Assalamualaikum warahmatullahi wabarakatuh. On this video, I will share you guys about some journal. This is journal from Indonesian Journal Nursing Practice. The title of journal is Nurse Knowledge and Their Performance on Cardiopulmonary Resuscitation of CPR in Critical and Emergency Care Unit. And for the author is Selvia Hesti Andriani, Fitri Ariana Setiorini, Anita Devi, and Arum Pratiwi. Next. Before we started, let me introduce myself first. Hello, my name is Rizkika Ramadhani. You can call me Ayu, and I'm on the second grade of nursing. Cardiopulmonary resuscitation, or CPR, is an emergency procedure that helps to support and maintain breathing and circulation in a client with harsh cardiac arrest. In a hospital, especially in emergency and critical care unit, cardiopulmonary resuscitation is very important because in both rooms, the number of morbidity and mortality are high. According to the American Heart Association, to view victims or cardiac arrest achieving standard CPR. As know, CPR quality must be high and that victims require excellent post-cardiac arrest care by organized teams with members who function well together. Education and frequent refresher training are likely the keys to improving resuscitation performance. The AHA has stabilized that initiation of CPR during cardiac arrest will increase the short and long-term outcomes for patient survival. Unfortunately, the quality of CPR performed by the public and healthcare provider alike is deficient, resulting in a low survival rate after CPR. Next, this research aimed to determine the relationship between the nurse knowledge level and their performance on cardiopulmonary resuscitation in critical and emergency care unit. Next, this research design used quantitative descriptive with a cross-sectional design approach. The research took place in the Emergency and Critical Care Unit in Muwardi Hospital of Surakarta. The sample was taken by the sequential sampling method. The criteria of the sample are nurses who work in emergency and critical unit. The next was nurse who performed CPR, and nurse with minimum graduated from the diploma of nursing. The last was nurse who were not an internship or orientation nurse. As a result, the total samples that involved were 30 nurses who work in emergency and critical room of the hospital. The instruments that were used were question form, which contained 24 multiple choice questions, which use the assess nurse knowledge and nurse skill is assessed by using a checklist that contained 13 items of SOP. Next. The result of the research on Table 1 is characteristic of respondent. In a Table 1 show that the frequency of men is more than women. The total of male respondent is more probably because men's strength is needed more according to their physical is stronger than women. Based on age, it can be seen on the table that age of respondent most are in the age of 24 to 25 years old. It means that in this hospital, nurses that work in emergency and critical unit care in productive age, where physical is really needed to give fast and right nursing care. According to the education level, the nurses are mostly graduated from diploma in nursing. It can be divided that most of the diploma graduation do not continue their study into bachelor degree and prefer to work directly. Professional nurses are divided as a nurse that develop his knowledge through high education by completing minimum education in diploma of nursing. The next is the working period. Most of the respondents are having a working period around 1 to 5 years. It is because the hospital recruit new employees. The presence of senior nurse, which have a working period of more than 10 years, can give working experience to the new nurse, which still lack experience related to cardiopulmonary resuscitation. The lack of working experience is showing someone performance and influencing their readiness in doing given tasks. The expectation is the longer someone working experience, the better performance they may have. Next, for the table 2, respondents' distribution based on their knowledge related to cardiopulmonary resuscitation in critical and emergency care unit. 23 respondents are categorized in a group which has poor knowledge, while the respondents who have a good knowledge is lesser. From 23 respondents who categorized less knowledge, and 14 of them have the working period of 1 to 5 years, while 9 out of 23 respondents has enough working period that more than 5 years. And next, for the table 3, respondent distribution based on their skill and performing cardiopulmonary resuscitation or CPR in critical and emergency care unit. Table 3 show that most of the respondents' skill on performing cardiopulmonary resuscitation include in the poor category, while the rest of them, 9 respondents, are categorized in good skill. Unfortunately, 2 of 9 respondents, which in good skill category, are still having poor knowledge about CPR. Skill that have by respondent not only from education but also from experience. And for the table 4, relation between respondent knowledge and their skill on performing CPR in critical and emergency unit care in one of the hospital in Solo. Table 4 demonstrated from 7 respondents who have good knowledge, 5 of them are having good skill on performing CPR, while the other 2 of them are having poor skill on it. From 23 respondents who have poor knowledge, 4 of them are performing CPR well, while the rest of it, 19 respondents, are in a poor category on performing CPR. Next. Patient emergency care is one of the hospital services that require fast, proper, and accurate service to prevent death and deformity. One of the quality service indicator is the response time, where this indicator is a process to achieve an outcome indicator that is life sustainability. Cardiopulmonary resuscitation knowledge is a vital model for nurses who work in critical and emergency care unit. Next. Respiratory and cardiac arrest in patients can occur suddenly and unpredictable. By knowing signs and symptoms fast and early, appropriate aid procedure. It can help to prevent worsening of the patient condition and give maximal chance for the patient to recover. Therefore, it is very important that nurse understanding about CPR and it needs poor knowledge also that CPR can be done rightly and fast on giving aid to the patient with respiratory and cardiac arrest.